Central Park, ask me anything.
I can ask you anything.
Yes, ask me anything.
So I have oily skin, very oily. My question is, what's your favorite tip for oily skin?
So I have two favorites for
Okay,
oily
oh,
skin.
I will take it, give it.
I love salicylic acid for
Oh,
oily skin.
okay.
I'm also a really big fan of niacinamide because it helps
Okay.
with regulating the oil as well.
Love it. Thank you, Dr. Stevens.
You're welcome.
I have a big question for you. Tell me, please, 3 big mistakes when we are talking about acne control skincare routine, please.
Yeah. So the first one is giving up too soon. Consistency is key. The second one I have is using too many products. Using too many products together can definitely lead to irritation. And then the third one is forgetting sunscreen, because so many people forget to wear their sunscreen, which can then contribute to more acne and irritation and hyperpigmentation, which is really big when you have acne marks after acne.
Thank you so much. I love it.
You're welcome.
My question is, should you moisturize if you have acne?
Such a good question. It's very common that those with acne and oily prone skin think that they don't need to moisturize, but you definitely do. Your skin barrier is so important, especially if you have that inflamed state, right? So moisturizer is actually for everybody.
What do you think about product abuse and how does it purge the skin? How do you treat it?
So for skin purging, that actually only happens with products that increase skin cell turnover. Not every product is causing a purge. Some people think a purge is happening when you're actually just irritated or your skin does not like a certain product. So it's important to differentiate between the two.
A very important thing that concern in Nigeria and Africa as a whole is the need to lighten your skin. Is it okay to use hydroquinone at a long time or high percentage to treat hyperpigmentation?
Hydroquinone needs to be used under doctor's guidance because you do want to take breaks from using it. And abuse is actually very common here as well in the States.
So this question is regarding steroid use, particularly injecting it into acne for treatment of inflammatory acne. In cases where, right, you've used the steroid, but now there's an atrophy or hypopigmentation on the skin, how would you treat that?
The good news is that it can be reversed in most cases. And you can treat it with normal saline, which will help to break up that atrophy that's happening underneath. That tends to be temporary, but with time, the skin color will come back.
There's been something viral going on TikTok with this face map, and it basically says that if you get a blemish on your chin or if you get it in between your eyebrows, it means something's going on in your body depending on where you get the pimples. Do you think that is true or is it not? Is it a myth?
So there's actually some truth to face mapping in that hormonal acne tends to happen around the jawline, hairline. It could be what you're putting in your hair products. But saying that like specific foods cause acne to show up in certain parts of the face is definitely the myth part.
Oh, hi, Doc. My name is Bonko from South Africa. What are the best skincare routines for an African climate?
So very important. Number one is going to be actually sun protection because melanin-rich skin tends to get more dark marks, more so than anyone else.
Right.
So sun protection is going to be important for that.
Okay.
Vitamin C is beautiful for the morning time, and I really love a good retinoid for nighttime.
I have like these black spots on my nose and I want to like rinse them out or make them smaller or less visible. So how do I do that?
One of the best ingredients to actually accomplish that is retinol. So you can use retinol in your nighttime routine, and that will really help with clearing it out.
Hi, Dr. Alexis. It's so nice to see you again.
You too.
So I have a question about sunscreen. So I'm from Nigeria. Nigeria is a hot tropical country, and I was wondering if the factor was important when it came to like SPF, like the number, because it gets really, really hot. Would it be okay to just use like an SPF 15, or does the number actually matter when you live in a hot country?
Yeah, such a good question. The number is actually only an indicator of the UVB rays, so that's burning. So yes, you want SPF at least 30 or higher, but UVA protection is actually more important for melanin-rich skin. So you need both. Look for something that's going to say broad spectrum, at least SPF 30 or higher.
My question for you is, does blemish affect the skin barrier?
Blemishes, of course, affect the skin barrier. That's the outer layer of the skin, and it can cause a lot of irritation, which is why you see a lot of redness with the blemishes. So yes, it certainly can, and it's going to be important to use products that can help to replenish your skin barrier, help rebuild it, soothe and strengthen it.
¿La pasta de dientes ayuda a secar los granitos?
Absolutely not. Pimples and toothpaste are not best friends. Please do not use toothpaste to dry out your pimples. Much better to use actual ingredients like benzoyl peroxide.
Okay, thank
You're
you.
welcome.
How many times should we cleanse our face a day?
So this is a really good question, and it actually depends on your skin type and your skin concern. If you have really oily skin and you actually wake up in the morning, you're still oily, then of course you can cleanse twice a day. But if you have really dry skin, eczema prone skin, and you're already waking up really tight, you may not want to cleanse and just kind of wash with water that morning.
I've got seborrheic dermatitis. Gets quite like red. I use currently the normal like blemish control and then like a moisturizer. Is there like something specific I'm supposed to be doing for it?
One of my favorite ingredients for a Sebderm is actually sulfur.
Sulfur. Okay.
Can be found in topical products, but also can be used as a shampoo too.
Is that in normally like moisturizers or like face wash? Or
Yeah, you can find it in multiple different ways. So it
Okay.
can come as a lotion, moisturizer, even a face wash.
Sweet. Thank you.
Question.
Yes.
I have teenagers and adolescents. Should my skincare routine be different from theirs?
Yes, actually it should be, because you should have your skincare routine tailored to what's going on with your specific skin. So my guess is you have different concerns than your teenagers. So it should be different.
What should I be doing differently?
Number one thing is going to be sun protection, because it will help with everything else.
Okay.
And then outside of that, it would be whatever your main concern is. So let's say you wanted to address anti-aging, right? Then we would focus on retinol for the
okay.
nighttime. And in the morning time, you would make sure that you are doing something that can help build collagen, like vitamin C.
Thank you so much.
You're welcome. I love your classes.
Ay, thank you very much. La rutina para mi piel.
So we're going to be talking about a very simple daily routine. And one of the best things that you can use is, of course, to start off with a nice gentle cleanser. You choose your cleanser based off of your skin type, and then follow that up with a moisturizer and SPF. Always want to wear your sunscreen.
Ooh, good night. Thank you.
Okay, I have a lot of questions. So, if I have dry skin on my body, is that possible to have oil skin on my face?
Yes.
It's possible?
And such a good question. It's definitely possible, because the different parts of the body actually have a different amount of oil glands. And the face definitely tends to have more oil glands than the body.
Okay, I didn't know that. And my other question is acne a genetic thing? Like, if my mom has acne, probably I will have acne too, or no?
So there is a genetic component to acne, and it does tend to run through family members. Not always, but there is a possibility.
And oh my God, I love your face. You have to give me all the advice on skincare. Do you use acne control?
So sunscreen is my secret.
Oh,
Every
okay,
day.
perfect. Thank you so much.
Hi, I am Dr. Temi. I'm from South Africa. I'm a dermatologist as well. Big fan of her. She's awesome. Are you seeing more people doing more aesthetic treatments like Botox filler?
Definitely. We are seeing a big influx of cosmetic procedures in skin of color specifically, which I love. It means that we're doing a good job of educating on the safety and efficacy of them.
We are here for that. So big up
for
for that.
sure.
Thank you so much.
I think I got away with the fight with acne, but now what should I do if I don't have acne, but I have a little scars and something like this?
So a lot of people who clear their acne stop acne products too early, and then you get a rebound.
Oh.
So one, you don't want to completely get rid of all of your acne products, but then you also want to do things to help with your scars, as you said, which retinol can do. So it can help your acne and your scars. So it's a
Yeah, I
double
was
win.
waiting for retinol.
Yeah.
It's the best.
It's a double win for sure.
Okay, thank you so much.
I want to know, for my type of skin, what would you recommend? Using retinol or acne blemish control gel?
So I actually wouldn't recommend one or the other. I think that you could benefit from both, using one in your morning routine versus using the other in your nighttime routine, because they're acting completely differently to help with clearing your skin in different ways.
So I can use both of them
Yep,
in the
just
morning?
separate your
Oh,
routine.
yeah. Okay, thank you so much. Thanks.
So my question is, I've been told before that sunscreen, as much as it has so many benefits, it prevents the absorption of vitamin D. Is that true? And if so, how to counter that?
Truly what you want to do is wear your sunscreen, because it definitely has more benefits than risk.
Yeah.
And you have to take a vitamin D supplement, which all of us should be doing anyway.
For people who constantly have dry lips, that you have to keep wearing either lip balm or Vaseline all the time, what's the solution to that? And why does that happen?
So oftentimes this happens because you're actually licking your lips, or you may be using a product that you shouldn't be. And if that's the case, of course, number one, stop. And then number two, find ingredients that can help keep the hydration in.
As a derm, what's your worst nightmare when it comes to your patients?
So the DIYs, right? Because then I have to spend my clinic fixing problems that were not necessary to begin with.
Yeah.
Baking soda is a big one happening right now,
Yeah.
and I'm having to spend a lot of time restoring skin barrier.
Skin barrier. Explain to me as if I was a kid, the easiest way.
Your skin barrier is your way to basically block out all of the bad things and keep in all of the good things. So we want to keep away anything that's going to be bacterial or harmful to the skin, but then we want to keep all the good things in, so the moisture and the ceramides that are actually in the skin.
Oh, very good. Thank you so much.
Do we always have to do skincare routines on the evening, or can we do it on the morning? Is the sun affecting it somehow?
Such a good question.
Thank you.
So your evening routine is actually the most important. You definitely don't want to skip out on the evening routine because you have to wash away all of the different encounters that you had for the day. So before you go to sleep, do your skincare, but not too close, or else all your products will end up on your pillowcase. Yeah.